Hi, my name is James Cantet, presenting IV fluid administration. First, I will check the medication administration record. I have a patient called Ellen Davis. Date of birth is September 19, 1980, and she does not have any known drug allergies. She does have two orders, cefazolin sodium 1 gram, 50 ml of normal saline intravenous IV piggyback to run over 30 minutes. Drop factor is 10 drops per ml, and I did the math, I get 17 drops per minute, and this is due now, and this is an antibiotic for UTI. Sodium chloride, 500 ml is the second order, 125 ml per hour IV. Drop factor is 10 drops per ml. I did the math and I get 21 drops per minute, and it's due now. First, I will sanitize my hands. After sanitizing my hands, I will verify my orders. I will start with the primary order. So I will verify first. I have 0.9 sodium chloride, 500 ml, sodium chloride 500 ml, and the expiry date is July 2031, and so it's not expired, it's good. And I don't see any cloudiness, I don't see any particles, and the bag is intact. The next thing I will do after verifying the order is I will open the primary tubing. Then after opening the primary tubing, I'll make sure that it's clamped. So I'll go ahead and clamp it. And then I will open the sodium chloride and spike it. Then I will open the spike, and I'll be careful not to touch to contaminate. So I'll go ahead and spike it. Okay, after spiking it, I'll squeeze the chamber. I'll squeeze the drip chamber to have some fluid halfway filled. Okay, then I will hang the IV bag. Prime it. I'll hand the IV bag and prime it to make sure there are no bubbles on the line, on the tube. So I'll go ahead and prime it. To make sure all air bubbles are out. Okay. All air bubbles are out, and then I will put back the lid. Then I will set this up here first. And then I did, I'm not sure if I mentioned that I closed the clamp. And then I will sanitize and then double check my order. So I have 0.9 sodium chloride, 500 ml sodium chloride, 500 ml, 125 ml per hour IV. Drop factor is 10 drops per ml, and I will have 21 drops per minute per the calculations I did, and it's due now. So I have the right order. Then I will sanitize, and then I have my second order. So my second order is cefazolin sodium 1 gram per 50 ml of normal saline intravenous IV piggyback to run over 30 minutes. Drop factor is 10 drops per ml. And per the month, I will need 17 drops per minute, and this is due now, and this is an antibiotic for UTI. So by medication administration order, I will verify, make sure I have the right order. I will open the package carefully. So here I have cefazolin sodium 1 gram per 50 ml of normal saline intravenous IV piggyback to run over 30 minutes. Drop factor is 10 drops per ml, and per the month I did, I need 17 drops per minute, and this is due now, and this is antibiotic for UTI. So I verified I have the right order. And then I'll go ahead and open the secondary tube. And I did also check the expiration is 06/2030, and also I checked to make sure there are no particles, no cloudiness, and the everything is intact. So I'll go ahead and open the secondary pack, the secondary tube, carefully without contaminating. And then I will close. I will use this later. I'll make sure to clamp it to close. So I clamp to close it, and then I am ready to spike. I will remove the lids, the cups. And then I'm ready to spike it. And then I will squeeze the drip chamber to fill halfway the fluid. And then I will hang the IV bag and prime. Open the cup and then prime it to remove all air bubbles from the tube. Okay. And then close the clamp. Clamp it back to close. And then this is ready also. And then I'm ready to go and see my patient. Knock knock, come in. Hi, my name is James Candet, and I'll be your nurse today, and I'll provide privacy. First, I will sanitize my hands after providing privacy. And I'm here because your doctor ordered some medications, IV fluids, that is cefazolin sodium 1 gram per 50 ml of normal saline intravenous IV piggyback to run over 30 minutes. Drop factor is 10 drops per ml, and per the mother did, I will have 17 drops per minute. And this is due now, and this is your antibiotic. And the next one is sodium chloride 500 ml, and 125 ml per hour IV, and the drop factor is 10 drops per ml, and per the mother will need 21 drops per minute, and this is also due now. Could you verify your name and date of birth for me? Ellen Davis, born September 19, 1980. Do you have any allergies? No, I don't have any allergies. So I verified information with my medication administration. And then I will put on gloves. And then I will assess the IV site. So I will assess the IV site for any signs of infiltration, any redness, and I will palpate. Do you have any pain? No. So no redness, no signs of infiltration or edema. And then I will clean the connector. That is the needleless connector. And then connect the primary line. Cleaning, I will connect, remove the lid and connect the primary line. And then I will remove gloves. And then I will sanitize. And then I will set the drop factor. The order and the amount I did, I will need 21 drops per minute. So I will set the rate and then count. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. And I will go ahead and clamp the roller. And then I will sanitize. After I sanitize, I'll put on gloves. Then I will assess the IV site for any signs of infiltration, edema, redness, and I don't see any signs of that. Do you have any pain? No. Then I will remove my gloves, and then I will sanitize. And then I will verify that cefazolin order, which is the primary, the secondary. Cefazolin sodium 1 gram per 50 ml, of normal saline intravenous IV piggyback to run over 30 minutes. Drop factor is 10 drops per ml, and per the month I will need 17 drops per minute, and this is due now, and it's antibiotic for UTI. So I have the right order, and then after verifying the order, I will lower the sodium chloride. So I have lowered the sodium chloride, and the other one will be up. And then after that, I will sanitize my hands. And then put on gloves. And then I will assess the IV site. Palpate, I don't see any signs of infiltration, edema or redness. Then I will remove my, I will remove my gloves and sanitize. And then I will clean the white pot. I will clean the white pot on the primary IV line. Scrub for 15 seconds, sorry. And then I will connect the secondary tube. Open the cup, then connect the secondary tube. Secondary line. And then I will open the secondary line. And then I will set the drip rate. Per the month I did for this one is 17 drops per minute, and then I will count for 1 full minute. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Then I will clamp it and then sanitize. To sanitize, I will put on my gloves. And then I will assess the IV site again for any signs of, I will palpate for any signs of infiltration, no edema and no redness. So the site is okay. Do you have any pain? No, she does not have any pain. And then I will remove my gloves. And then I will sanitize. and then I will document on DocuCare.